Hello everyone. So, am I audible? Is the screen clear so that I can start the session? So, yes, am I audible? Is the screen clear so that we can start the session? Yeah, please let me know. Okay, I am audible. So, yes, we can start the session now. Okay, so this is the session of the general histology and the epithelium. So, this is the general histology, epithelium and the lymphoid organ which I will discuss, and this session will be followed up with the MCQ related to the topic. So, this session will be ultimately followed by the MCQs related to the topic. So, this is how we have planned today's session. So, let us proceed and let me know, am I audible? Okay, Vinay Pandey, is it okay? Am I audible? Is the screen clear? Okay. So, yes. Okay. So, myself Dr. Monalisa and I have done my MD Anatomy from Armed Force Medical College, Pune. Yeah, so I have done my session from Armed Force Medical College, Pune. And before starting the session, let me tell you about the special class features. What features? The features are, it's an interactive session where the learner and the educator can interact among themselves, and this would be highly beneficial for the students. The polls are conducted, raise your hand, never miss a session, and after finishing the session, lecture notes are provided to you. So, that is also ultimately beneficial. PDF notes will be downloaded anywhere, anytime, read from the top educators of Unacademy platform. Now, if I talk about the plus course, what are the benefits? So, on adding on with the special class, you get the benefit of assessing both the live and recorded versions of the session. You can study from India's top educators in the medical field, complete in live tests and quizzes, study on the device of your choice, assess more than 25,000 MCQs, and with soon about 1 year of subscription and more, you can have the printed notes also provided. So, these are the benefits which can be catered by you. When I am talking about iconic subscription, the benefits of, so when I am talking about iconic subscription, the benefits of the special and plus, along with that the benefits of the prep ladder can be assessed by you. So, this is again highly beneficial for you. Okay. So, now other than that, boost your medical preparation. So, this is the offer which is valid. Okay. So, these offer is valid, it is continuing, and the offer is that you can have a, so the offer is that when you are taking the subscription of 2 years, you are getting 4 months absolutely free. When you are taking the subscription of 1 year, you get 2 months absolutely free, and when you are taking the subscription of 6 months, you are getting 1 month of subscription absolutely free. For this, you can use my code ANAT10. So, I would like to tell everyone, those who are interested for taking the subscription of Unacademy, they can definitely go with the code of ANAT10 to get 10% discount. So, I would also like to add on with the with one of the session which is going on with the November 28, 5 p.m. is the timing. Enroll in it, and you can enroll in this session, and this will be highly beneficial. You can participate in the biggest scholarship test for the NEET PG, and amazing prizes of 1 crore scholarship worth. So, do participate in this. It's absolutely free. Enroll by using the code ANAT10 and be present for 28 November 5 p.m. session. Now, let's start with today's session. So, okay, let's start with today's session, that is epithelium. So, for epithelium, I would like to describe, so what all things we are going to study in epithelium. When I am talking about the topic of epithelium, we are going to study the epithelium. So, in that, I will firstly like to tell you the types of epithelium with an example, the features of each and every types of epithelium. I will show you many histological diagrams, and you can correlate with this histological diagrams, and you can correlate what are the importance and how you are knowing to identify the slide, and with an example. So, अगर हम trend देखें, if I talk about the trends of the MCQs which has been asked for the previous year NEET PG examination, this epithelium topic is very important, and lymphoid. So, अगर general histology, if I talk about general histology topic, this is the this is very important, and if I talk about this, important questions are definitely asked from the epithelium types with an example, and also with the lymphoids organs like spleen, thymus gland, tonsil and lymph node. So, in this session, I will cover up all these topics, and this session will be followed up with a special class. Okay, so those who are listening, this session will be followed up with a special class at 6 p.m. So, I will cover this topic of YouTube session, and then the session will start with the with the special class that is happening at 6 to 7 p.m. That is an MCQ session. So when I talk about the classification of epithelium is based on protection, absorption, surface and lining epithelium, secretion, glandular epithelium, sensation that is neuro epithelium, contraction that is myoepithelium. So these are the different functional aspect of the epithelium. With an example, we have got protection. The basic function of epithelium is protection. Where it wants to give protection, it is lying on the surface lining. It also is involved in glandular epithelium, where it is lining the ducts of the serous acini, mucous acini, and the function is secretion. Sensation that is present in olfactory epithelium, gustatory epithelium and auditory epithelium, example neuro epithelium. Contraction where it contracts and the secretion happens from the duct system of acini, that is myoepithelium. So let's talk about the classification of epithelium. So yes, my dear aspirants, let me first tell you about the features of epithelium. Okay, so I would like to highlight the features of epithelium. When I am talking about epithelium, the features are, it is having an apical part which is called as the free part, and it is having a basal part. Okay, epithelium is having an apical part and the epithelium is having a basal part which is called as the basement membrane. So what you can appreciate here, so this is the apical part. Okay, this is the apical part which you are seeing, and on the basal aspect this is the nucleus. What you are seeing, these are the nucleus which you are seeing. This is the basal aspect of the epithelium, which is having the basal aspect is having the nucleus also, and underlying the basal aspect we have got basal lamina and we have got reticular lamina in the basement membrane. Okay, underlying the basement membrane we have got connective tissue. Okay, these are the general features of epithelium which you are seeing. Apical aspect can be appreciated, also the basement membrane can be appreciated having the basal and the reticular lamina. Okay. Now, intercellular junction and the junctional complex. Next topic is to know intercellular junction and that of the junctional complexes. Okay. So, when we are talking about intercellular junction and junctional complexes, we have got definitely following are the types. We have got Jonah Occludance, we have got Jonah Adherence, we have got Macular Adherence, and we have got gap junction. So, these are the basic types of the intercellular junction which is present in the epithelium. The categorization are Jonah Occludance, adherence, macular adherence and gap junction. So, what is important that we should have a basic idea of the function and each type of these junctional complexes. So, let's start with the first, that is Jonah Occludance. My dear aspirants, when I am talking about Jonah Occludance, it is present on which part of epithelium? The first important point about the MCQ is also that it is present in which part of epithelium? The answer is, it is present in the apical part of epithelial cell. It is present in the apical part of epithelial cells. It forms bands and tight junction. So, what happens? This Jonah Occludance, by the name only it means occludance. What do you mean by occludance? The occludance, okay, when we are talking about Jonah Occludance, it is forming a seal between the two membrane. Okay, what do you mean by the term occludance? It is forming a seal between the two membranes, transmembrane protein, that is, so transmembrane protein claudine and occludine prevents passive flow between the cells. Okay, so what happens? There is a band or a tight junction seal which is formed between the two epithelial surfaces, and what it contains? The contents are, it contains transmembrane protein, that is claudine. Claudine prevent passive flow between the cells. What it is doing? It is preventing any kind of the substance passing freely between the cells. So, this is important that it is present in the apical part. Occludance is the transmembrane protein claudine and occludance is present. So, this is also important for MCQ. So, wherever the important target points for cracking the entrance exam, I will mark it as an MCQ. Now, what about the other cell which is formed? Jonah Adherence. When I am talking about Jonah Adherence, it lies below Jonah Occludance. Where it is lying? It is located below Jonah Occludance is the Jonah Adherence. Okay. It is strengthening and stabilizing the occluding band. So, the function is, it is providing strength to the Jonah Occludance. The function of Jonah Adherence is providing strength to Jonah Occludance. located, Jonah Adherence is located just below Jonah Occludance. Cytoskeleton of adjacent cells, transmembrane glycoprotein cadherines are there. What is present? Transmembrane glycoprotein cadherines are present there. Okay, and it binds to active filament and provide cell motility. What does it provide? It is involved in providing cell motility. So you can see here apical part पे क्या है? Jonah Occludance है, and immediately below, if I highlight this diagram, what you can appreciate, let me show you. Okay, the apical part is containing Jonah Occludance, and just below it we have got Jonah Adherence, which is supporting the Jonah Occludance. Okay. What does it contains? Glycoprotein cadherines, again very important for MCQ, and bind to actin filament and provide cell motility. These are all the points which is very important. Next is macular adherence. Next we are talking about macular adherence. So when I am talking about macular adherence, okay, when I am talking about macular adherence, its disc-like structure do not only form as a belt. What happens? It is forming a it is lying adjacent. What you can say? It is lying adjacent to Jonah Adherence. It is located on the lateral surface of epithelial cells. Where it is located? It is located on the lateral surface of epithelial cells in the form of disc. In the form of disc, 30 nanometer approximately the dimension. The next important point for your MCQ session is you have to know the proteins which is contained in macular adherence. Okay, the proteins which is contained in macular adherence is belonging to the family of cadherins, and it is desmocholine, intergrins and desmolin. So these all names of the cadherins family proteins must be known to you, which is forming the content for the desmosomes and hemidesmosomes. Where is the hemidesmosomes? What is macular adherence containing? Desmosomes and hemidesmosome. If I want to be more peculiar about the location of hemidesmosome, it is located or founded on the basal domain of the epithelial cell. So what does its function is? Its function of hemidesmosomes is that it is lying on the basal aspect and it forms a connection with the underlying basal lamina. It forms a connection between underlying basal lamina. Got it? This is very, very important function of hemidesmosome. Now, gap junction. Next important point is gap junction. When I am talking about gap junction, the function is it transfers the nutrients and the signal molecules between the cells. The most important function is transfer of the nutrient molecules. The protein located is connexin. By the name only it forms a connection between the adjacent cells. The function of connexin is to promote the exchange of large molecules. So what you can say in one line, it is forming a connecting or communicating channel between the epithelial cells. It is forming a connecting or communicating channel between the epithelial cells. Got it? Now, surface modification of epithelial cell. Now, we are talking about surface modification of epithelial cell. So, if I talk about surface modification, it is in the form of following types. It is microvilli, it is having sterocelia, it is having cilia and glycocalyx, which is located on the microvilli of the apical part of epithelium. So, there are certain modification which is seen on the apical part of epithelial cells. The certain modification which is seen in the apical part of the epithelial cells are, if I talk about that modifications are in the following form: microvilli, sterocelia, cilia and glycocalyx. I want to explain each of it. This is the electron microscopic diagram which has been shown, where you can clearly see the microvilli, you can see the sterocelia and the cilia. Okay. So what is very important is to know where these modifications are present with the means of an example. So let's start with the first, that is microvilli. What is the function of microvilli? It increases the surface area of the cell. Microvilli is increasing the surface area of the cell, and the primary function of microvilli is absorption of molecules. What is it? It is causing absorption of molecules. It is arranged in a very regular fashion and striated border, example small intestine. Here one of the important topic which must be striking to your mind, that what do you mean by the striated border? My dear aspirants, when the arrangement of, if the arrangement of microvilli is occurring in a very systematic way and it is arranged in a very systematic way and regular pattern, if it is arranged in a regular pattern, this is called as striated border, which is present in small intestine. When the arrangement of this apical modification is in the irregular fashion, अगर ये arrangement बहुत irregular होती है, the microvilli, which is the apical modification of epithelium, is arranged in a very irregular form, then it is called as brush border. The example of the presence of brush border type of epithelium is in the PCT of kidney. What is PCT? Proximal convoluted kidney, proximal convoluted tubule of the kidney and the gallbladder. These are the two places where we found brush border type of microvilli. That means irregular arrangement. That means irregular arrangement of microvilli. Irregular arrangement of microvilli. That means irregular arrangement of microvilli. Now, my dear aspirants, now I want to highlight this diagram. In this diagram, you can certainly see, okay, so yes, in this diagram, you can certainly see the modification, okay, okay. So, in this diagram, you can see the modification here, microvilli. So, you can see these projections, smaller projection which is seen in the luminal aspects. What are these? Okay, these projections which you are seeing is the microvilli, which is the apical modification which is found in PCT, which is found in the striated border of small intestine, and this is how it looks. It is very clear once you go for electron microscopic feature. So, once you go for electron microscopic features, then it is very clear. Now, let's talk about sterocelia. Okay, let's talk about sterocelia. When we are talking about sterocelia, they are longer microvilli. Okay, these sterocelia are longer microvilli. These sterocelia are longer microvilli. And the example of sterocelia are, it is present in epididymis and that of internal ear. It is present in epididymis and that of internal ear. Got it? Okay. So, this is how it looks. If you will see the enlarged view, you can see this is the enlarged view where you can see the sterocelia. These are longer microvilli. These are longer microvilli. Okay, these are longer microvilli. One more important point is this is immotile. This is not, it is not, sterocelia is not having any kind of motility. So, this is immotile longer microvilli. This is immotile longer microvilli. Okay. Example, epididymis and internal ear. Now, moving on to the next, that is cilia. When we are talking of cilia, this is again another apical modification which is seen on the surface of epithelial cells, but it is quite motile, it is having motility. So, it is acting in a process, it beats in a very coordinated fashion. Okay. So, it beats in a very coordinated fashion. It beats in a very coordinated fashion, and examples are respiratory tract and that of uterine tube. Okay. So, it acts, what you can say, it is the apical modification of epithelium which is motile. Okay. Very important point about this is that it is having motility. The example is important for your MCQ session, and it is present in fallopian tube, which is also called as uterine tube of respiratory tract, because it is beating, it is coordinated in one direction. So, it is not letting any foreign structures or any dust particles or microorganisms to enter inside the respiratory tract, or it is also causing the motility of ovum. So, see here this is a diagram where you can see these modifications on the apical aspect. the longer one which is also having the motility, this is ciliated epithelium present in respiratory epithelium and that of fallopian tube. The next is Glycocalyx. Okay. When we are talking about Glycocalyx, it is the apical modification. It is again another apical modification. Glycocalyx is a cell coat or fuzzy coat which is in the form of apical modification which is present over the absorptive epithelium of small intestine. So, when you will see, this is a modification which is occurring, lying over the apical modification in the apical aspect of epithelium, where on the outer aspect of the microvilli another covering is there, that is called as Glycocalyx. And what is the function of this Glycocalyx? It is concentrating the ions prior to its absorption. This is again an important point for MCQ. Concentrating the ions prior to absorption, and this is also increasing the absorption in case of small intestine. So, it is rich in polysaccharides, protein hydrolytic enzymes, and it is increasing the absorption process. Glycocalyx, which is also called as a fuzzy coat, is a covering which is located over the microvilli. So, here you are seeing the microvilli is longer. Actually, it is again an electron microscopic view. So, only a clear picture of microvilli has been seen, which is again covered by this coat, and this coat which you are seeing, this coat, I am talking about this coat which you are seeing is the Glycocalyx, which is concentrating the ions before the absorption. Now, let us move on to the classification of epithelial cells. So, when we are talking about classification, we have got simple, compound and glandular epithelium. If I broadly describe the epithelium, this is of simple epithelium, compound epithelium and that of glandular epithelium. The example of simple epithelium is, it can be either squamous epithelium, it can be either cuboidal epithelium, columnar epithelium, ciliated epithelium or pseudo-satisfied epithelium. These are the example of simple epithelium. Okay. Squamous pavement type, cube-like is the cuboidal epithelium, columnar column-like with the nucleus towards the base, ciliated means having a apical modification of motility which is provided by the motility of the cilia, and this is ciliated one. Pseudo-satisfied means it appears to be multi-layered, but the fact is that it is single layered, and it appears to be multi-layered because of the location of the nucleus at the different level. Compound epithelium means multiple layered, and it can be either stratified compound type which is multi-layer or transitional which is multi-layer. Other than that, we have also got a glandular epithelium which is having the function of secretion. So, let us move with each one. My dear aspirant, those who are listening, the whole of the epithelium topic I have categorized with its important example, and the list which is provided to you along with an example is very, very important, because this is the fact which is definitely going to be asked if the question is asked from the general histology. So, if I want to tell you the most important topic of the histology MCQs to be solved is the general histology part. So, you have to solve the MCQs, and this is categorized by examples of epithelium. So, the most simple one is simple squamous epithelium. When you will see under the light microscope, it will appear like a line. So, examples where the simple squamous epithelium is present, it is increasing the absorption. So, it is present in alveolar lining of the lung, it is present in the lining of blood vessels, lymphatic vessels, pericardium and that of pleura. So, all these are the examples. These are all the examples of simple squamous epithelium. Here one of the diagram is shown to you. Let me slightly highlight this diagram. So, what I told you, this is the nucleus. You can see here it is having the nucleus and it appears like a line. So, you can see here it is appearing like a line, and this whole epithelium, which is, this is the, when surface modification is seen, then it will be appearing like a pavement. What is this? This is the simple squamous epithelium. Flattened nuclei is there, and it is present in the lining epithelium of the lumen of the blood vessels, lungs and the pleura, that is pleura and pericardium. Now, continuing with the example of simple squamous epithelium, the examples are Bowman's capsule of the kidney, mesothelium, that is the lining of the body cavities, and loop of Henle, major part of loop of Henle. These are the Examples: Bowman's capsule of the kidney, mesothelium, lining of the body cavities, loop of Henle, that is the major part. Okay, see here. This is the mesothelium. This is the mesothelium. The lining epithelium which you have seen here, this is the lining epithelium which you have seen. This hole which is having the nucleus flattened, lining of the serous epithelium, this is present in the pleura part, which is called as the mesothelium, simple squamous epithelium. Now, simple cuboidal epithelium. The name is cuboidal, that is definitely on the shape which is cube-like. The example are thyroid follicle and germinal epithelium of the ovary. Is the thyroid follicle and that of germinal epithelium of the ovary. The two slides also I want you to show where you can clearly identify this follicle lining is in the cuboidal epithelium and that of germinal epithelium. Anyone is having any doubt, they can type their doubt in the message. Now, let me show you the one slide. So, this slide which you are seeing is of thyroid follicle. So, here what you can appreciate, this is the colloid. What is this? This is the colloid and this is the follicular epithelium. So, this, can you see here, this is the epithelium which is surrounded. So, this is cube-like. What is the appearance? It is cube-like, as you can see here, this is cube-like. And these are the nucleus which is situated in the center. So, this is how the cuboidal epithelium. So, in case of thyroid gland, the lining follicles are the example of cuboidal epithelium. Same way, when you see the germinal epithelium, so see here when I am showing you the germinal epithelium, here also you can see here, these are all cube-like. This epithelium which is on the outer part, this is again cube-like with the nucleus in the center. So, this is again example of cuboidal epithelium, germinal epithelium of the ovary. Now, coming with the list of, so what is very, very important for your entrance exam, that you should be by hatting the list of the epitheliums which is commonly asked for your MCQ session. Next is simple cuboidal epithelium. Okay, so we have already seen the two slides, thyroid and that of germinal epithelium. Continuing with this, I want to tell you about the example of simple cuboidal epithelium. Other examples which should be known to you is the PCT and DCT, proximal convoluted tubule of the kidney and the distal convoluted tubule of the kidney, also in the part of the loop of Henle. It is also present in the pigment layer of the retina and small duct of exocrine gland. Small duct of exocrine gland. Got it? Example of simple cuboidal epithelium: thyroid follicle, germinal epithelium, PCT, DCT, pigment layer of the retina, small duct. Please mark this point. It's the small duct of exocrine gland. Okay, and also in the some part of loop of Henle. So, very nicely you can see here, this is the kidney tubules where you can very nicely appreciate this epithelium. Here it is found in the PCT and DCT. This shape is cube-like with the nucleus in the center, which is having a spherical nucleus, as you can see. This is the nucleus which is spherical and circular, and this is an example of simple cuboidal epithelium. So, absolutely correct, dear. Now, let us talk about simple columnar epithelium. Simple columnar epithelium is present in stomach, intestine, colon, gallbladder, collecting tubule of the kidney. So, these are the example where we have got simple columnar epithelium. So, the shape of the epithelium cells are column-like. It's column-like, and this is the reason it is called as simple columnar epithelium. The nucleus is towards the center. See here, the nucleus is lying towards the center. This is the nucleus, and you can see here the nucleus is lying towards the center. but not exactly towards the basal aspects. Sorry, please correct it. I want to tell that it is when you were seeing the nucleus in the cuboidal epithelium, it was in the center, not exactly at the basal aspect. But now you are seeing the columnar epithelium simple here, the nucleus is towards the basal aspect, towards the basal aspect. Now, and the examples are small intestine, colon, that is large intestine, gallbladder, collecting tubule of the kidney and the stomach. Other than that, it is also found in the gallbladder and the PCTs, in some part of the PCT of the kidney. Okay, in some of the larger PCTs, columnar type of epithelium can also be found in small intestine. So here you can see it is having microvilli. So what is this projections? The red and the black arrow is showing this projected part, which you are seeing is the microvilli. What is it? This is the microvilli. Okay. So it is having striated border. When it is regularly arranged, it is having irregular arrangement, then it is the case of gallbladder and PCT of the kidney. So these are the examples which we can quote in the example of simple columnar epithelium. Moving on to the next. Columnar epithelium having ciliated columnar epithelium. What does that mean? It is having motile apical modification of epithelium. So in this category we have got 4 examples: respiratory epithelium, uterine tube, fallopian tube, central canal of the spinal cord and the ventricles of the brain. My dear aspirants, there is a particular name, anyone wants to reply? There is a particular name which is the columnar epithelium residing the lining epithelium of the central canal of the spinal cord and that of ventricles. In that case, we use the term ependyma. We use the term ependyma. So in case of ependyma, actually ependyma, what is ependyma? Ciliated columnar epithelium which is lining the central canal of the spinal cord and that of ventricles of the brain is called as ependyma. It is called as ependyma. Okay. So here you can see here this star-shaped lumen is seen, mucosal fold is seen, and this epithelium which you are seeing, this is the ciliated columnar epithelium. Okay. So you can see here this is ciliated columnar epithelium. This is a slide of fallopian tube and this is the ciliated columnar epithelium. Other example is in the respiratory epithelium also you can see these projections are cilias. Okay, this is columnar epithelium, this is the nucleus towards the basal aspect, and this is again seen in the ventricles of the brain and in the case of respiratory epithelium. Cilias are very nicely seen. This is an enlarged view where you can clearly appreciate the cilia. So this is highly important for the MCQs, and in the past few years, 2 to 3 years, I have seen various times these questions has been asked. What is the lining of the ependyma of the brain? What is the lining for the central canal and the ventricles of the brain, and that of the example of ciliated columnar epithelium. Moving on to the next. Let's talk about Eustachian tube. So anybody, what is the other name of Eustachian tube? Vinay Pandey. What do you mean by Eustachian tube? It is also called as auditory tube. It is also called as pharyngotympanic tube, which is forming a communication between the pharynx and that of tympanic cavity, middle ear cavity. So it is called as Eustachian tube. Now Eustachian tube, which is also called as auditory tube, is having a lining epithelium which is ciliated columnar epithelium. See here, the lining epithelium is ciliated columnar epithelium. So now here I want to explain one more important point. See here, this canal which you are seeing here is the auditory tube. Okay. So here one communication is there, here one here the communication is with the tympanic cavity, that means it is communicating with the middle ear cavity. Here the communication is with the pharynx, here the communication is with the pharynx. So you can see here the auditory tube or the Eustachian tube is forming communication on one side with the pharynx and other side with the middle ear. So that means it is having 2 types of epithelium. So if the MCQ has been asked, you have to know both the epithelium. You have to know the example of both the epithelium. The epithelium which is on the sides of the tympanic cavity, which is facing the middle ear cavity. The epithelium which is protruding to the middle ear cavity, this type of epithelium is of which variety? Columnar epithelium, ciliated columnar epithelium at the tympanic cavity. And the epithelium which is lying over near the pharynx, these type of epithelium is pseudo-satisfied ciliated columnar epithelium. Here many goblet cells are also residing. So epithelium on the end of the tympanic cavity is ciliated columnar epithelium. The epithelium which is towards the pharynx, the epithelium is of pseudo-satisfied ciliated columnar epithelium, which is similar to that of respiratory epithelium, and it is also having goblet cell. So it is important that you should know both type of epithelium present in the auditory tube. Now the next kind of epithelium is the multiple layered epithelium. What do you mean by the term stratified? Stratified means multiple layer. It's not just single layer, it is multiple layered, and the example is stratified squamous epithelium. The example is stratified squamous epithelium. It is present in external ear canal. It is present in cornea, it is present in conjunctiva, it is present in nasal vestibule, oral cavity, tongue. Also in the palate, tonsil, epiglottis, terminal part of vagina, anal canal and terminal urethra. So my dear aspirant, there is a huge list. So this whole list which I am telling you, here the whole list which has been detailed in this PPT, all these lists must be known to you, because these all points are very important for your MCQ session. So you should know all the example of multi-layered stratified squamous epithelium, which is exactly present on those area which needs more of protection, and there is chance of more of infection protruding in that area. So there is multiplication and more strengthening is given to these type of epithelium. The examples present in ear canal, it is present in conjunctiva, anal canal, vagina, oral part of epiglottis, tonsil, palates, terminal urethra. So my dear aspirants, do revise the example, very important for your MCQ session. Now when we are talking about esophagus also, esophagus is having multiple layers. So see here, can you see this is the epithelium? Okay, this whole is the epithelium. So what you can see that it is not single layer, but it is multiple layer. So what you can appreciate, it is multiple layered, so it is called as stratified squamous epithelium. It is multiple layered, so it is called as stratified squamous epithelium. Okay. Now let's talk about stratified squamous keratinized epithelium. Stratified squamous keratinized epithelium. So when we are talking about stratified keratinized epithelium, it is again multiple layered and it is overlapped by keratin deposit. It is also having keratin deposit over it. Means more of protection is provided, and the example are epidermis, mucocutaneous junctions, distal part of anal canal, outer aspect of tympanic membrane, gingiva, hard palate, filiform papilla of the tongue. All these are example of stratified squamous keratinized epithelium. Okay, stratified squamous keratinized epithelium. Got it? Please note down the example. Epidermis, which is having an additional layer of keratin deposit. So one way to remember the example of keratinized epithelium is that these kind of epithelium will be present to the area which is lying very close to the skin aspect, very close to any lumen or outer aspect. So like hard palate. Also in the tongue, which is filiform papilla, it is present in distal most part of anal canal, outer aspect of the eardrum, mucocutaneous junction, epidermis. So again, this is important for your MCQ session. So all these list of example for the various category and the types of epithelium should be at the tip of your tongue if you want to cater all the MCQs related to this topic. Now let's talk about the epithelium of tympanic membrane. What do you mean by tympanic membrane? It is also called as an eardrum, and it is the eardrum which is separating the external canal with that of the middle ear. See here. Here this is the tympanic membrane which is called as the eardrum, and this tympanic membrane or eardrum is separating the external ear with that of middle ear. Okay, so it is separating two aspects, parts of the ear. One is the middle ear and other is the external ear. See here. So it is on outer aspect. When we are talking about the outer aspect which is lying towards the external ear, the lining epithelium or the outer aspect which is lying very close. So अगर ये membrane like structure है, अगर ये flap like membrane like structure, for example it is eardrum, its outer part is this and this is the inner part. So inner part will be close to that of middle ear cavity, outer part will be close to the external ear. So the part which is lying close to the external aspect or external canal is having which type of epithelium? It will have keratinized stratified squamous epithelium. It will have keratinized stratified squamous epithelium, and the part of epithelium which is lying on the inner aspect, which is lying close to the middle ear cavity, these epithelium will be non-keratinized stratified squamous epithelium. Non-keratinized epithelium on the inner aspect and keratinized epithelium on the outer aspect. Now the next category is stratified cuboidal epithelium. Stratified cuboidal epithelium is present in the ducts of the gland. Exocrine ducts like lacrimal duct, salivary duct and sweat gland duct. Again important for MCQ. So if you remember, I told you जो भी SNI के ducts हैं, its smaller ducts are having cuboidal epithelium, but when we go towards the larger component of the duct, when we go for the larger duct, the epithelium size and height is also increased. So stratified cuboidal epithelium is present in exocrine ducts like lacrimal duct, salivary duct and sweat gland duct. Okay, it is present in lacrimal, salivary and sweat gland ducts. Okay. So here also you can see here there are so many nucleus. So here you can see, let me highlight one of it. So I have taken the epithelium example. See here, the nucleus is at multiple layered. It is multiple and it's at multiple level, and this is stratified cuboidal type of epithelium, means cube like epithelium is multi-layered. So this is again an example of stratified cuboidal epithelium. So here we can see the slide, and the other example here also we can appreciate the stratified cuboidal epithelium. Now the same thing if we go more towards the major duct, what I told you, जो भी ducts हैं उनका initial part simple होगा, and when we are moving towards the larger component of the duct, when we are moving towards the larger component of the duct, the the size of the or the height of the epithelium increases. So largest duct of the exocrine gland and the palpebral conjunctiva, these two are the example of stratified columnar epithelium. These two are the example of stratified columnar epithelium, again important for your MCQs. So do revise, this is very important for your MCQs, the example of stratified columnar epithelium. So you can see here multiple nucleus is there and the epithelium is column like. So it is stratified columnar epithelium. Now again what I have seen in the previous year of examination, not only in the NEET PG exam but also in the AIMS and the INICT, they have asked about the epithelium of the urethra. Different histology MCQs has been asked about the epithelium of the urethra, and why it is important, because the urethra, in case of the males, the urethra is having different parts and the different part of the male urethra is having different types of epithelium. So let's focus on that. If I talk about prostatic urethra, so see here the parts of urethra is prostatic, membranous, penile and distal most part. So I have categorized here the prostatic urethra, the membranous urethra, the penile urethra and that of distal most part of the urethra. When I am talking about the prostatic urethra, that it is that part of the urethra, as you can see here, this is P for prostatic part and this is prostate gland. So the part of urethra which is lying in the prostate gland is called prostatic urethra. The lining epithelium is transitional epithelium, is of urothelium or transitional epithelium. Membranous means the part which is lying in the, so this part is a membranous urethra. So this part, this is the membranous urethra. Again I will use the term M. The membranous urethra is the part of urethra. This is the membranous urethra which is traversing through UGD. What do you mean by UGD? Urogenital diaphragm. urogenital diaphragm. So, the part of urethra which is traversing through urogenital diaphragm, that is consists of two muscles. What is it? The name of the muscles is sphincter urethrae and deep transverse perineal muscle. The part of urethra which is traversing through urogenital diaphragm is an example of membranous urethra. Now, coming to penile urethra. Penile urethra, the lining epithelium is pseudo-satisfied columnar epithelium, which is passing through the bulbous penile part of the penile urethra of the penis. Distal most part, when I am talking about the distal most part of the urethra, that is lying very close to the external aspect or the opening, close to the skin. So, its epithelium will be satisfied squamous epithelium, similar and very close to the skin type. Penile is pseudo-satisfied columnar type. So, my dear aspirants, it is at most important that you should know each type of epithelium: membranous, penile urethra and the distal most urethra and prostatic urethra. All these part of the urethra epithelium must be known to you. Now, talking about pseudo-satisfied columnar epithelium. Now, here the word pseudo means false, not true. And these type of epithelium is present in male urethra. Just now we have discussed in the male urethra, membranous part of the urethra. It is also present in the olfactory epithelium. It is also present in pseudo-satisfied columnar epithelium, is the type of epithelium along with the cilia which is present in respiratory epithelium, eustachian tube, epididymis and ductus deferens. All these are very important examples of pseudo-satisfied columnar epithelium. It is present in male urethra, olfactory epithelium, trachea, eustachian tube, epididymis and ductus deferens, which is also called as vas deferens. Means the meaning is that it is exactly the true form. It is not multiple layered, but because of the location of nuclei at different level, it appears to be multiple layered. So, see here two slides I have shown here. So, if I talk about this epididymis, let me just highlight it. These are the sterocelia which you can see. These are sterocelia and this is one epithelium. So, nucleus is at different level. So, this is columnar type and nucleus is at different level. Because of it, it appears multiple layers. So, pseudo-satisfied columnar epithelium is present in epididymis. Now, coming to neuro epithelium. Next important point is neuro epithelium. Okay. So, yes, when we are talking about neuro epithelium is present in ear, it is present in nose, it is present in tongue, eye and retina. So, that means the epithelium is also having the function of some special function is attached to it. So, in case of ear, it is for auditory function. In case of nose, it is for olfactory function. In case of tongue, it is for the gustatory function. In case of eye, it is for the visual function. So, these kind of epithelium example is neuroepithelium. So, here you can see the epithelium which is lining in the tongue is also having special taste buds. It is having taste glands, it is having taste pores are there on the gland which is spindle shape. As you can see, this is the taste bud and it is having cells, supporting cells, olfactory, it is having the cells, that is the gustatories here is in the function of taste cells are there, the supporting sustentacular cells and the stem cells are there. So, taste cells are there, basal cells are there and supporting cells which is called as sustentacular cells. These are the cells and this is present in the epithelium of the tongue having the function of taste sensation, gustatory function. Now, let us talk about transitional epithelium. When I am talking about transitional epithelium, the epithelium is multiple layered and also have the function of stretchability. It can be stretched. So, transitional epithelium is actually, if we categorize the example of transitional epithelium, it can be either of 3 to 5 layers when it is in the relaxed position, and it can be just 2 layers or 3 layers when it is in stretched position. Okay, so that is important for you to know. So the examples are renal calyces, ureter, urinary bladder, and the most initial part of the urethra. So only in the prostatic urethra also we have got transitional epithelium. So and the outermost cells, for example, this is the epithelium which you are seeing, this is of transitional epithelium. The outermost cells, as you can see, is ballooned, umbrella cells. So what is it? It is umbrella cells. The outermost cells is umbrella cells, as you can see here. So this is having umbrella cells on the outermost part, and it is multiple layered. Towards the basal aspect, it is having basal cells, and in between it will have the polyhedral cells. So outermost cells is umbrella cells, and the middle layer of the cells is of polyhedral type, and the basal aspect is having the basal cells columnar type. So these are the layers of the cells present, and when it will be in a stretched condition, for example, when the urinary bladder or the urethra is stretched condition, it will be just 2 to 3 layers, but when it is in a relaxed condition, it will be 5 to 6 layers. Examples is very important for your MCQ session. Also, identification of slide is important due to the presence of umbrella cells. So I want to share this slide with you, where you can see the 2 stages of transitional epithelium in case of urinary bladder. On the collapsed and other is distended. When it is collapsed or in relaxed stage, what you can see, the number of cell layer is 5 layered. It is 5 layered. As you can see, when it is in the relaxed condition, the number of cell layer is just 2 to 3. It is 2 to 3 layered in relaxed condition, and it is up to 5 to 6 layers. It can be in the case of when it is in the relaxed condition, when it is distended. Okay, when it is stretched and distended with the urinary with the urine and all, then at that condition it is just 2 to 3 layers. But when it is not stretched, it is in relaxed stage, the urothelium or the epithelium is of 5 to 6 layers. So with this, the epithelium topic has been done, in which various examples of the epithelium has been categorized. What is most important for you is that you should know the function of each type of epithelium and the example of each type of epithelium and where it is present. That is most important for you. Now let's talk about the histology of the lymphoid organ. Now, in the lymphoid organ, the histology of the slides, which is very important for your examination. हम क्या क्या पढ़ेंगे? तो हम पढ़ेंगे thymus gland की histology. We will talk about the lymph node histology. We will talk about the histology of the spleen. We will talk about the histology of tonsil. So this is the 4th slide, which is very important for the lymphoid organ. So let's individually discuss each type. So let's start with the first slide, that is thymus gland. Okay, so this green color structure which you are seeing is the thymus gland. Okay, this is the thymus gland which you are seeing. This thymus gland is bilobed structure. Thymus gland is a bilobed structure which is shown in green color. And what is the location of thymus gland? It is located in superior mediastinum and anterior mediastinum. Where it is located? What is the location? It is present in the lower part of the thymus gland is present in the anterior mediastinum, and the upper part of the thymus gland is present in superior mediastinum. Upper part of the thymus gland is present in superior mediastinum, lower part is present in the anterior mediastinum. So let's talk about the structure of thymus gland in detail. So when I am talking about the thymus gland, it is again having a cortex part and it is having a medulla part. One of the basic point which is very important for your thymus gland to be known to you is that thymus gland is not having the supporting network which is formed of reticular fibers. So no reticular fibers. So this has been asked so many times in the MCQ session, that which lymphoid structure is having no reticular fibers. So when as a whole or in general we talk about lymphoid structures or the lymphoid organ, we talk that we have got reticular fibers which is giving the supporting network or structural support to the glands. Okay, structural support or the integrity, structural support and the connective tissue framework. If I talk about the connective tissue framework or the stroma part of the gland is provided by reticular fibers. But when I am talking about thymus gland, this is not true. Here the thymus gland is not having any kind of reticular fibers, but the supporting network is provided by epithelio-reticular cells. So, which is the structure which is providing the connective tissue framework in the case of thymus gland? It is epithelio-reticular cells. So, it is the epithelio-reticular cells which will provide the structural support to the thymus gland, epithelio-reticular cells. Epithelio-reticular cells. So, let us talk about the thymus gland in detail. Okay. So, when I am talking about the thymus gland, let me slightly highlight this. Firstly, I would like to explain the outermost covering is formed by the capsule. So, there is an outermost fibrous capsule and it will have incomplete stroma. So, trabecules, incomplete divisions of the cortex and the medulla. The outer part of the thymus gland is having the cortex part where you can see it is darker stain. So, see here, this is darker stain, this is the outer part, this is inside there is trabecules, and again the thymus gland is divided into number of lobes and lobules. Inside you will have an darker stain structure which is called as the cortex, and the innermost structure is lighter stain. Can you see here? This is the medulla. So, this is how we categorized the thymus gland: outermost covering of fibrous capsule, presence of cortex and the medulla. Now, my dear aspirants, why the cortical area is darker stain? The reason is that it is containing mature lymphocytes. It is containing mature lymphocytes, and the density of the lymphocyte which is located in the cortical part is much more as compared to the medulla part, and you will see T lymphocytes. So, only T lymphocytes is present in thymus gland. It is the principal lymphoid organ. The inner part which is lighter stained is the medulla, where the immature T lymphocytes reside. Along with it you can see red color structure which is shown, acidophilic structure. So, let me highlight this diagram. So, can you see this red color structure slightly brightly stained? This is a acidophilic laminated body which is located inside. Exact function is still not known, and this structure is called as thymic corpuscles or Hazel corpus. The number of thymic or Hazel corpuscles increases with age, and certain cases we have also traced that there is calcification present in this thymic or Hazel corpus. So, this is the characteristic feature of identification of thymus gland. So, please note down the important point of identification. So, let us start with that. Yeah, thymus gland histology. So, we will talk about the thymus gland histology. The most important point for the thymus gland histology is that it is consist of an outer cortex. It is consist of an, okay, so yes, so you can see these are the important features of thymus gland which has been shown here. These are all the features of thymus gland which I have shown you. And if we have to, so direct MCQ has been asked that where is the Hazel corpus present and what is the location. So, the answer is thymus gland. Now, my dear aspirants, I would like to show you this diagram where you can see. So, here clearly you can see the thymus gland histological features which I have shown you. Okay, you can clearly see the histological features of the thymus gland as shown. So, please note down this. Now, I would like to show you the image. So, which type of lymphocyte is lying there? T lymphocyte is located. Which type of lymphocyte is located? T lymphocyte is located, which is containing reticular cells. This is the thymocyte which is located. T lymphocyte is located, which is containing the reticular cells, that is thymocytes, as you can see here. Many T lymphocytes are located. Okay. In the medulla part, the immature type of T lymphocyte will be located. So, immature type of T lymphocytes will be located, and the mature T lymphocyte is more residing in the cortex part. It is lying in the cortex part. Got it? Now, we will talk about the blood thymic barrier. So, this T lymphocytes and also the epithelial reticular cells. What I told you, that epithelial reticular cells is important, that it is forming the part of thymic barrier, that is blood thymic barrier. Blood thymic barrier is formed by T lymphocytes. T lymphocyte, the part of the thymus gland, that is epithelial reticular cell, which is forming the blood thymic barrier. Okay. So, prevention. So, what happens? Blood thymus barrier, when we are talking about blood thymic barrier, we have to know the important constituents of the blood thymic barrier. So, the important constituents of the blood thymic barrier is epithelial reticular cells, perivascular connective tissue and capillary wall. Okay. So, it is formed by epithelial reticular cells. Epithelial reticular cells are the cells which is forming the supporting network or connective tissue network of the thymus gland. So, it is formed by endothelium. The layers are endothelium, basement membrane of the endothelial cells, perivascular connective tissue which contains macrophages and fibroblast and all. Other than that, basement membrane of epithelial reticular cells or epithelial reticular cells. So, all these 5 layers. So, in short, what you can say, epithelial reticular cells, which is forming a supporting network of thymus gland, is also forming blood thymic barrier. The next important point is, what is the importance of blood thymic barrier? So, it is preventing the contact of blood thymic barrier is preventing the contact of the developing antigens, T lymphocytes, that is immature T lymphocyte, to contract with the antigens present in the blood. So, there is no interaction, or you can say antigen antibody reaction is not formed between the immature T lymphocytes and the blood antigens. This is the function of use of the thymus. Now, next slide which I want you to explain is the lymph node. Next slide is of lymph node. Now, lymph node slide, how you are going to identify? Basic features of lymph node is that it will have an outer fibrous capsule. So, an outer capsule is there. Inside the same pattern, inside the lighter stain will be the medulla, and the outer part will be having the cortex. So, again it is having a fibrous capsule FC, then it is having the medulla part. Okay, it is having the medulla part, it is having the cortex, it is having the outermost fibrous capsule. Now, lymph node histology. Outermost covering of lymph node is formed by fibrous capsule, inside there is then cortex part and there is a medulla part. In the cortex part there is lymphocyte aggregation, Actually, this lymphocyte aggregation is called as lymphatic nodule. What is it called as? Called as lymphatic nodule.